Hi, Dr. Brian Heaberlin here with Lexington ENT and Allergy, and I've done other videos where I talk about Eustachian tube dysfunction. The Eustachian tube is the internal natural tube that we all have that goes from under our eardrum and it empties into the back of the nose. Many times people have obstructed or narrowed or not opening properly Eustachian tubes, and that can cause a lot of problems like fluid in the ears, ear pressure, hearing loss, and just other things. We place ear tubes sometimes for that condition. But today I'm actually going to talk about a whole different problem, and it's where the Eustachian tube is open too often. So the Eustachian tube in healthy adults is not supposed to be open all the time. It only opens intermittently throughout our day when we swallow or we move our jaw or we yawn or other things that pull a muscle that's attached to the Eustachian tube downward, which opens the tube temporarily. And that temporary opening allows the pressure to equilibrate and for the eardrum to function normally. But if the Eustachian tube is open all the time, then people often have this uncomfortable fullness and echoey feeling. Many times they can hear their own breathing, and that's called a patulous Eustachian tube. So it's not a very common problem, and it's sort of strange that a lot of the symptoms associated with a closed Eustachian tube are the same symptoms people get when they have an open or patulous Eustachian tube. So if you have those things, especially the key things that tip that off to us is hearing your own respirations or hearing your own breathing and sort of that echoey component along with the fullness in your ears, then a patulous Eustachian tube could be your problem. Now, a patulous Eustachian tube, because it's a little less common, is also a little more difficult problem to treat. We don't really have any great methods to make that Eustachian tube close down very well. Sometimes there's some medication drops that we can use to cause a little bit of congestion and swelling. If people are using nasal steroid sprays, which often work very well to help open the Eustachian tube, we'll often have them stop those nasal steroid sprays, and that can help some. Sometimes people get a patulous Eustachian tube after they've had a rapid weight loss. So it's not uncommon for us to hear someone say, well, they had a bariatric surgery and lost 50 pounds and now they have this ear symptom. And sometimes those issues just get better over time. One of the main things we do with patulous Eustachian tube dysfunction is actually just reassure the patients about what's going on and explain the problem to them. There are some more aggressive invasive procedures done at different centers in different places around the world to help with that in extreme cases where simply reassurance and living with it are not adequate. So if you have some problems with your ears, we're happy to see you here at Lexington ENT and Allergy and evaluate those conditions and see if you could have a patulous Eustachian tube. Thanks.